Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. I'm sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Autumn, who is a dual certified family and psych nurse practitioner. Currently, she is working full-time in her own practice. She owns an integrative psych-based practice where she provides counseling, nutritional assessment, neurofeedback, and psychiatric-based medication management. She has been running her practice for a year and states that it is not doing very well. She's needing assistance on what the next step should be in her practice. Hey, Autumn, how are you?
I'm good. How are you, Justin?
Hey, I'm good. Thanks for hopping on here. So let's go ahead and get started. So tell us about yourself. So you're a dual certified family and psych nurse practitioner, and what kind of things you've been doing?
So I've been a nurse since 2001, and did my family in NP in 2009. And I did about 10 years of physical medicine and rehab, which had some pain management. And then kind of when the opioid epidemic hit, I was affected, just lost some friends, lost some family members, and I got interested in addiction treatment and kind of picked up part-time there, really liked it. Ended up doing full-time addiction treatment, but couldn't get any of my patients into psych for months on end. So that's when I was like, well, I'm going to go back to psych school. There's such a need here. Was like my job, everything was going good. And then the pandemic hit, and during that process, they closed my clinic down. So then I was kind of stuck in psych NP school without really a clear plan. As I went through clinicals and saw there was just so many meds after med after med, I was like, gosh, I really don't feel like I want to do this, but I didn't want to not finish it. So that's kind of when I thought, well, maybe I can do more of a integrative approach to psychiatry and, have my own business and kind of run things the way that, that I would like to have them run.
Okay. And it's not going very well, this practice.
No. So the past couple months, I've made a little bit of money, maybe like a few $100s. But before that, I was barely breaking even. I was working up until January at a job that I got that was like supposed to be psych for, 12 to 18 hours a week. But it was, when I got in there, it was really like 25 hours a week. And then I was supposed to leave at 12, but then they needed me back at 3 for a meeting or to get on here to Zoom. And I wasn't able to give my practice any attention. And I definitely wasn't making any money then. So I ended up leaving there to go full time in January, kind of feeling like, if I'm going to do this, I've got to kind of do it.
Okay. So over the last 5 months, then you've been really diving in full time into your practice.
Yes.
Okay. And this is when you've been able to generate a little bit of money. It sounds like not much. The bills are being paid though.
Yeah, the bills have been being paid for the past few months, but like I'm not paying me anything.
Right. Okay. Do you accept insurance or is it just cash?
No, it's just cash. And I wish I'd listened to more of the podcast sooner, because I've heard you say several times now, like psych is a hard sell for niche practice for cash, but I hadn't found you yet when I first got started.
Yeah, unfortunately, it really is. I mean, this patient population, right? I don't have to
Hmm.
explain it, but I mean, it can be done. Do you live in a highly populated area? What's your region look like?
Yeah, the county's got the county I'm in has got about 120,000 in it. The little office I'm in, I rent inside like a holistic family medicine center. And it's in a small town, but I do get a lot of patients from there that are kind of like minded that want to treat without, getting on a bunch of psychotropic meds. So it's been a good referral source. But yeah, like I said, the county is about 120,000, so it's pretty big.
Pretty big, yeah, yeah. Okay, there's people with money.
Yeah, not a ton, but I would think enough. I mean, that the little practice I'm in, she stays really really busy. Where I rent from, she has like IV infusion and things, and people are constantly in there. She has two NPs working for her, and that's like a family practice kind of thing that she does there.
I got you. So you're subleasing a space somewhere to do this.
Yes, I have two offices in that building, one for where I see patients and one where I do the neurofeedback.
Okay, and where are you getting patients from now?
I do have a Google ad running, so I get some patients from there, and then I've had some patients that are like family members or friends of other patients, just like referrals. And then I get a lot from the where I am at the holistic center. I get a lot of patients from there that see my stuff out front. But I mean, I don't have any signage. I do have like a flag thing that says mental health and wellness, but the way it was set up, she kind of told me going in that I wouldn't, have signage. So I don't know how bad that's hurting me.
Yeah, I mean, it could be. This neurofeedback thing, is this kind of where your focus is?
Not strictly my focus, but it's a great adjunct therapy. And it's like all I have to do is hook the patient up and then kind of take them off. It's not linear neurofeedback, so there's not a lot of clinician focus for it. So it's a nice money maker where I don't really have to be too involved in it.
Okay. Okay. So when the patients that you have, what are they calling for?
They some of them for counseling, but most of them just their anxiety or depression or ADHD, and they don't want to be on medicine. They don't want somebody that's just going to give them, push a med on them and put them out the door. But if you mean diagnosis wise, it's primarily like anxiety and depression and attention deficit.
Yeah. Okay. And so these people call you and they want more of a holistic, natural approach to the psych versus
Right.
versus all these meds.
Yeah, and there's a pretty for all the insurance practices too. Like they're all out. Like there's a lot of competition, but like you can't get in anywhere around here for 3 to 4 months at least. And some people just say, we can't even give you a projection. We'll put you on a list. So
Yeah.
I know there's the need, but I guess maybe not enough need that people are willing to pay out of pocket.
Yeah.
for it.
Unfortunately, they're not right. I mean, that's evidenced by it's not really taking off.
Right.
But on the other side of the coin here, you have really focused in on your practice now. For the last 5 months, you've been able to break even in the last couple months, and you are making a few $100s. So you are on an upward trajectory. It's just a slow trajectory.
Yeah, that's fair to say.
Right. Okay. So don't get too down on yourself. Things are improving. Okay. So that's good.
Okay.
It's just slow. And the reason why it's because it's cash based. I think it's probably the reason, cash based opioid addiction, cash based Suboxone, it used to be a big thing 10, 15 years ago, but now insurance pays for it willingly. And, a cash based opioid addiction practice, cash based Suboxone practice is a hell of a lot slower than what it used to be. Right. Yeah. Cash based psych, cash based primary care is typically a lot slower than if you accepted insurance. It's just, it just is what it is.
Mm-hmm. And I feel like maybe the economy is like a struggle for people too, because I had some regular patients that were doing well and stuff, and they've had to be like, well, I'm going to have to come back to, every other week or whatever, we're doing counseling, say, but have cut back some just because, like, I guess, everything's so expensive right now and they have kids and, I get it.
Yeah. Inflation, right? I mean, stuff's expensive. It blows my mind how much some things are now. So, okay, well, I think you kind of know the answer here. I think that if you really want this practice to get successful, I think that you're going to probably need to accept insurance if you
So I
want
guess
to.
that's my question is like, I hate to be so like jaded against insurance, but they were so exhausting at the end of like me actually, working for somebody. Like I felt like I spent more time trying to get things approved in peer to peers with people that weren't even my peers. They might have been doctors, but like I would be trying to do something for physical medicine rehab and they'd put me on with like an ER doctor. And I was just so frustrated with the whole thing. So I'm just wondering if I have to do that. I mean, should I do that or should I just move on to one of these like easier niche practices and just start over?
Yeah, that's up to you, right? I mean, I agree with you. Insurance sucks. It does, right?
Mm-hmm.
That's going to be up to you. Like, how bad do you want to do psych? How bad do you want to keep doing what you're doing? If your heart's truly into this and you really want to help lots of people and actually focus on this, then you need to accept insurance. If it's really not your passion, you really don't care either way, then you might just need to scrap it.
Yeah, I guess that's what I need to figure out. I think I have a lot of thoughts tied up in like um looking back, which I shouldn't like what a waste of like time and money. That I got this psych degree. It just didn't pan out like it was supposed to.
Right.
Um
Well, you can't let a past thing like that dictate, you know, how you operate your life, what direction you're going. You just can't, right?
right.
And yeah, you can't allow, a failing business to, you can't just be grasping for straws. I know it's going to work. I know it's going to work. I'm just going to keep doing this, because you put money into it. You've put time into it. You've put your heart and soul into it. You've done all of this, right? And
Hmm.
it's sad. It's sad to see it fail because you put so much time and effort into it. Like, I understand. I get that. I failed multiple times on things, but you just, sometimes it's just easier to cut your losses, scrap it, and move on if you just really don't see an exit or a way to fix the problem. And I think that, the area that you're in, you have, you only have a couple things that you can do here. You can either accept insurance. Okay. Let's think about this from an actionable standpoint. You can either
Okay.
accept insurance and deal with that. Okay. If you truly want to do this, that's probably going to be the easiest fix that you can do. How many people call your office and don't book an appointment because you don't accept insurance?
No, quite a few. I get quite
Okay.
a few phone calls, and the minute I say I don't accept insurance, they're like, "Oh,
And
okay,
never
that's
mind.
it." Yeah.
There you go. Okay. The other option you have is you spend a lot of money marketing this, getting the word out because maybe people just don't know you exist. But at the same time, it's the patient population, it's the service you have, right?
Hmm.
Like, it's foolish to keep spending money on something when the world is telling you that's not what they want.
It's like a reasonable time frame. I know I can market better. I talked to a friend of mine that does marketing yesterday, and he's like, "You're not doing the best you could marketing as far as like Facebook and like putting things out there. If I like go in hardcore at that on the marketing, what would be a reasonable time that I could just say, okay, I gave it everything, and it's just not coming around?" Because you're right, I am on a bit of a slow upward trajectory. I guess just gets frustrating to go to work every day and never pay yourself anything. But like,
I
how
know.
many months more would you give it if I'm not going to take insurance? And like, how long before I have to? Do you think is reasonable before I say, you know what, it's just not working?
3 months.
3 more months.
I give
Okay.
it. I give it 3 more months. I typically tell people that if you start a business, you start a practice, and you've given it your all, after 6 to 12 months, it's probably time to cut your losses, scrap it, and move on to the next project.
Okay.
The last thing you want to do is catch a falling knife kind of a thing, right? You just like, what's the point in spending more money on this? Just keep putting more and more time and effort and money into it, and it's just not taking off, right? That's foolish. So I'd say 3 months. I'd say give it 3 more months. cut your losses. So marketing it, more, maybe just people don't know you exist. Maybe people just don't know what neurofeedback is. Maybe people just don't know what it is that you do, right?
Okay.
So I think that you need to make it as clear as possible on your website. This is what we do, and this is what we provide. These are the benefits of what it is that we do. Maybe you can start there too. Because
I heard one podcast recently where you had recommended people with psych practice, like maybe focus in even more than that. Like maybe I start like tailoring the website more towards what I'm seeing, which is like anxiety and ADD. Have you heard back from those ladies at all?
I'm trying to think. I don't think I have, but from some of the psych NPs that I've talked with, yeah, like when you focus in on something, you become more of the expert at that, right? So what if you did anxiety, ADHD, tied in the neurofeedback or something? Like that's what you kind of just become an expert at. But are there enough patients in your area to justify being that niched?
Okay.
I don't know. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. Your county's 120,000 people, right?
Yeah. Is that pretty big? It seems big to me. Is that big?
No, that's a good size. It's pretty much all you need for one of these niche practices. But for what it is that you're doing, I don't know if that's big enough because it's such a niche specialized thing, right? Yeah, it just seems like it could be difficult. If there was 1 million people, then I bet there would be plenty of people for this, plenty of business for something so niched. I only do ADHD and anxiety, and I focus on neurofeedback, for example, or this integrative approach to get you off your medications and stuff. The thing is, though, is that the reason why you need a higher population for something like this to possibly work is because what's the turnover rate? Once the patient's taken care of and they're fixed, like, what's the reason why they keep seeing you?
Yeah, that's a problem I've had too, because you would be amazed, like if you correct their vitamin D and their vitamin B and actually get them like off the couch and off their phone, like a lot of times people turn around pretty quick. I mean, some of these nutrition deficiencies are, it's kind of all they need to turn the corner, and then they're good. So, right. I mean, that's a good thing. I mean, that's what I want, but it does, then I don't have the patient anymore.
Right, exactly. You fix them, right? And they move on, which is great. You've cured them. That's great, but it's not good for business.
I took the men's health class and I was like, well, this is genius because they're pretty much a patient forever unless they go somewhere else, because once they need their testosterone, they're there,
They're there. They love it. There's no reason for them to get off of it, So yeah, that's the thing, the recurrent aspect of this. Like I'm thinking here, you're certified as a family NP, you're certified as psych, you can pretty much do whatever you want. It's like, what's holding you back from just starting more of like a functional medicine, integrative medicine kind of practice where you're seeing physical medicine stuff, you're doing the psych, you're doing the thing that you're doing now, but now you're just kind of expanding it a little bit more instead of being so niched. I feel like I contradict myself sometimes. Like, I think a very focused niche practice is a great way to go, and that's what most people should do. In your situation, maybe something a little bit more broader would be better because you are dual certified. And maybe if you started adding some other stuff into the practice, some weight loss, some HRT, you said you're focused on these vitamin injections, these nutrient deficiencies, things like that. Like People are looking for functional medicine and integrative medicine practices. They are. But if you're too focused, you're going to be skipping out on those patients that are looking for, can you help me with my diabetes? Can you help me with my thyroid deficiency? Can you help me with, my IBS? You know what I mean?
Yeah. And I mean, even the owner of the clinic where I am, we've talked about this, about like kind of this failure to launch I'm having. And she doesn't have any problem with me. I mean, that's what she does, but she doesn't have any problem at all. She's, booked 8 weeks out and has 2 NPs under. She's like, I don't care if you do primary care. She's like, I don't care what you do. I think I'm there helping pay the rent and we're friends. And, so that's definitely a possibility that I could kind of branch out and add some other services.
You could. So like, instead of just completely starting all over, maybe just add some more services. Like if you really don't want to do insurance, then expand out a little bit more. She's booking out 8 weeks for weight loss or HRT or something. Why don't you start doing that if she's cool with it?
Yeah. Yeah, I could definitely do that. And, I thought about this too, because my practice is called integrative mental health and wellness. And I thought, well, I could just pull the mental out of there and it would just do a DBA for integrative health and wellness. And that's kind of the same thing, don't you think?
Absolutely. Yeah. And then in the subheading, you say something like, integrative medicine and psychiatric care or something.
Mm-hmm.
For sure. Why couldn't you do that? And then people would still call you for the neurofeedback and stuff because they might find you on Google still. And then they'll start calling you for the functional medicine based stuff or weight loss or whatever it is that you want to do.
Yeah, I definitely think I would be open to that because so many things can be fixed from a functional standpoint. And that's kind of always where my heart's been, is like getting people better through, lifestyle versus all the medications. That's why I knew psych wasn't for me once I got in clinicals, because of just med after med after med. I was like, ooh, this isn't for me.
Yeah, that's the problem with psych. A lot of psych, it's just pill for this and a pill for that, right?
And then a pill for the side effect from this and that.
Right. It's not I'm not down talking psych or anything at all, but that tends to be the case a lot of times, Same thing with treating diabetes or something, there's really no difference. Just a pill for this and a pill for that instead of, understanding the root cause, right? Mm-hmm. So there is something to be said about that. It is something that people are looking for. So maybe you just need to expand out a little bit more, that's pivoting your business. So instead of scrapping it and starting over, you're just pivoting a little bit. You're just changing some things up.
Mm-hmm.
Nothing wrong with that.
Yeah. And if I do like add men's HRT, I don't think she would want a dispensary in there. Is that still somewhat profitable if I have the medication mailed to the patient's home, like discussed in the course?
That's super profitable.
Okay.
Yeah, no. You don't have to dispense medication to be profitable, okay? In fact, just going through a compounding pharmacy is, it's not as profitable. We're talking about a 10% difference here. It's not that much.
Okay.
Okay.
All right. Because I had thought about that she probably doesn't. She doesn't want like the headache of anybody interfering. That's why she doesn't do insurance. And I know if you get a dispensary, then you can be looked at, right? Especially if it has testosterone there.
Well, if you're dispensing any kind of controlled substance, yeah, there's a lot of regulatory stuff that goes behind that. It's a pain in the ass. Don't bother.
Yeah.
That's nothing. Don't worry about that.
I guess that's what I was kind of wanting to get at, is if you had said like scrap the whole thing, I was going to be like, okay, well, what about men's health? But it sounds like I don't necessarily have to scrap the whole thing. I can just kind of reinvent it slightly and move on from there.
Correct. Exactly. And then you market based off of, various like little DBAs. For, if you want to market, throw some ads out for men's health, throw some ads out for men's health, throw some ads out for weight loss. And throw some ads out for maybe some of the integrative psych stuff, whatever. Once you once you get some patients in the door for some of these things, they tell their friends, word of mouth happens, and then it builds up quicker.
Yeah. Yeah, I can definitely see that. And I'm licensed in 2 states, so I could also do, telehealth as long as they keep letting us do that for controls.
Yeah, for sure. You can continue to do that. Take advantage of it while you can, right?
I mean, I think that's about it. I mean, I kind of think I knew the answer, but I've been a little bit all over the place with it and needed to hear it, from somebody else, like basically take insurance or figure something else out. So.
I mean, that's pretty much your 2 options, right? There's not really a whole lot you can do here. Like you either take insurance, you'll probably get busy. You'll probably have a very profitable practice. Like I know some psych MPs that kill it, do very well for themselves. Low, mid-low to mid 6 figures, $300,000 a year. But dealing with the headache of the insurance, right? Is that worth it to you?
And it doesn't seem like it would be.
Right.
I probably want to try something, probably want to try like maybe expanding services before I come down to taking insurance. That's probably going to be kind of my last option.
Your
It's
last
the last
option.
thing I would do. Yeah.
Well, remember though, it takes 6 months to get credentialed. So
Yeah.
it's one of those things like, maybe should you go ahead and start the credentialing process under a different entity or something and just have that there in case you do need to pivot to that in 6 months?
Yeah, I wasn't sure how that worked. I know how to get on and do, I don't know what it stands for, but there's CAQH, which is like what the insurances can look at. Like I know I'm on there and have, the ability to take insurance through other entities, but do I have to start all over?
You have to start
since I
all
have my
over.
own practice?
Correct. You'd have to completely
Oh,
just
wow.
like credential the entity. It's going to take 6 months.
Okay.
Okay. So it's
Yeah.
not something that you can just pivot and do real quick. It doesn't work that way. So if you want as a redundancy, as like a financial kind of emergency kind of a thing, like maybe just like a plan B sort of a thing, create a separate entity maybe, or just get the entity that you're under, start getting it credentialed. And then that way, 6 months from now, once you're credentialed, if you have to pivot to that, you can pivot to that. All right. And then you can operate this cash-based stuff out of another entity. If once you become credentialed, because once you become credentialed, you can't charge insurance patients cash for covered services under the same entity, but you can do it under a different one.
Yes. Yeah. I remember that from being part of a startup before. We never could get credentialed because we couldn't afford not to take payments while we were waiting. I remember that.
Yeah. So it's just forming another LLC or whatever. It's not a big deal, So, if you want to do that, it would be more of like a plan B, a contingency kind of a thing. But you might never have to actually pull the trigger and bill insurance or something. You just have this, this empty shell here that's credentialed, but you might never even have to use it because maybe 6 months from now, maybe HRT takes off for you. Who knows? You just don't know. No way to know. Those are pretty much your options. I say that you want to stay cash, go ahead and just start integrating a few other things into it and see what happens.
Right. Well, I appreciate you hopping on here, especially today on a holiday.
You are welcome. It's no problem whatsoever. I hope that this was kind of a quick episode, but I hope that, you got a plan in place. So just curious, what service do you think you're going to focus on first?
Probably the HRT and probably the men's first because I've already taken the class. But the reason for that is I've already done a few checking on men with depression just because, that could be part of their depression. So I'm a little bit more comfortable with that. And then I'll probably get the women's class, right behind that because it really goes into holistic psych anyway to check their hormones. So that it would be a benefit that I knew about that.
Oh, yeah, for sure. 100%. Yeah. Quick question before we get off here, though. Is there a lot of competition in your area for some of this HRT stuff?
No, I did check that. And we have a 25 again. I don't know if do you know what that is?
I do not.
It's like a chain they have a membership hormone replacement and like some anti-aging stuff in there. And it's not terribly close. And it's like a $3,000 a year membership. And then there's other services you can get there. And then the only one that's relatively close, she has, I guess, just started seeing men because it used to be called like Her Health, but now it's just the lady's name. And I looked online and she said she's serving men now, but there's like no evidence. There's no male reviews, no male testimonials. And then she's only open 9 to 4, like 4 days a week. So it's very limited. She makes her availability very limited. I think that she does so well that she's not really actively recruiting that much.
I got you. Yeah. Well, if there's not really a whole lot of men's health in your area, people doing, testosterone replacement therapy for men, there's definitely an opportunity there. No question.
Yeah, there's nobody that just says like men's health over here. I live on the border of Indiana and Kentucky, and there's quite a few places in Louisville, but like it's kind of weird. People over here don't like to go to Kentucky. Like they don't like to cross the bridge. There's like an $8 toll if you go back and forth. And it's just kind of a weird it's a weird thing over here that we don't like to cross the bridge. So yeah, lots of stuff in Louisville, but nothing over here.
Okay. Well, I mean, there you go. There's an opportunity there. If you want to do men's health though, and really focus in on men's health, then, you need to do a DBA or form another entity for men's health. Okay. Call it men's health, separate website, everything. Because men's health doesn't really tie into ADHD and anxiety and neurofeedback. Like that could be something that you could offer as well. But if you're focusing in on that men's health, you're treating men, right?
Mm-hmm.
Right. So you can't, having a bunch of women in your practice doing neurofeedback on them for their anxiety. Like, I don't know, it just doesn't really complement each other.
So what do I do about location and stuff? Would I have to get like a separate office or
No,
to do that?
no, you can do it out of the same place. Just make it neutral.
Okay.
Just to kind of make it like a gender neutral kind of vibe. You know what I mean?
Yeah, and it is like the waiting room and all the stuff is, all the other practitioner that owns the building. It's all her stuff, and it's very neutral as far as it's mainly like the pictures on the wall are like food, like
Right, it's
food
very
or
generic.
medicine, kind of like that. It's not anything geared towards, a specific like geared towards a man or a woman. It's neutral.
That should be fun. And at the end of the day, men really don't care. They just want their, they just want to feel better. They just want to, be treated. So I don't think it's going to really matter that much. And as you grow,
So that would be another LLC or no? Would that
you don't
be an LLC?
Yeah, you don't necessarily have to do another LLC at first. You can just do it kind of under a DBA, kind of a similar name, but just call it Men's Health and Testosterone Clinic or something. You can just do that, and then once it starts taking off, maybe if you want to form a separate, a separate LLC for it later down the road, once you've proven that it actually works, then you can do that.
Okay. And that means 2 malpractice policies. Is that correct if I have 2 LLCs?
You just need to name that other LLC on it. That's all. Same policy.
Oh, okay.
Just make sure the policy actually, covers you for the service that you want to provide.
Okay.
Okay. Some policies don't cover testosterone replacement therapy in men or weight loss or something. So you want to make sure that the malpractice policy you have is going to cover you for what it is that you want to do.
Okay. So I just need to call and talk to somebody and be sure.
Yeah, exactly. Yeah. And then just have them put your so if you do another LLC, just have them name that as an endorsement on your policy and you should be fine.
Okay.
Yep.
I'm going to write that down. Name as an endorsement.
Exactly. Any other questions?
No, I think I just needed to get clear on some things. I hadn't thought too much about kind of opening it up more. So that's a great advice. I'm excited that, I've got that option.
Yep. I think that's probably, be the cheapest way to do it. Easiest way. Getting credentialed with insurance is going to be a pain.
Mm-hmm.
Like it's going to take a while.
Yeah, for sure.
Yeah. So cool. Well, you've listened to these episodes before, and I like to end the episode with you asking me a question. Is there anything that you're curious about in terms of my life or my experience or my work or anything like that?
Yeah, if you, I thought about this. If you had either personally or professionally a do-over somehow, would you take it? Would you do anything differently? Or do you kind of feel like what's happened has led to this point and you're just content with the way it is?
Oh, man, that's a deep question. I mean, there's all kinds of stuff I wish I could change. If I could go back, I mean, I was a problem child. I was a wild child. I made all kinds of mistakes. I did a bunch of dumb stuff, but I guess professionally, would I go back and change some things? At this point in my life, I'm pretty content. A younger Justin, maybe 6-7 years ago, probably would have been like, yeah, I wish I would go back and major in finance or something instead.
Mm-hmm.
Sometimes I kind of think about that every once in a while. I'm like, it's more of my heart in finance versus medicine. And sometimes it is, sometimes it's not, so at this point in my life, I'm pretty content where I'm at. I've done very well for myself, being a nurse practitioner, having my own practice, having a lead MP, like this stuff it's treated me very well. And so, I don't think I would change anything at this point, but if I could go back, there's definitely some things I would change. I probably would have done a little bit better in undergrad and, maybe major in something else. But at this point in my life, I think I'm pretty happy where I'm at. What about you?
I don't think I would change anything. I mean, it all just kind of is unfolding. So I used to think I should have never quit the job I was at for 10 years, but I know that even though I like the people, it was kind of soul sucking. So I try not to have that thought. So no, I don't think I would change it. Just kind of let it unfold, I guess.
Exactly. It is what it is, right?
Mm-hmm.
One day at a time. Well, cool. That was an interesting question. Thank you. All right. Well, cool. This was a great episode. I wish you the best of luck. And if you ever want to do a follow-up, just let me know.
Yeah, thanks so much. Have a great rest of your day.
You too. Take care. Bye.
Bye.
I hope everyone enjoyed the episode with Autumn. I hate to hear a nurse practitioner struggling in their business, but it's just the reality of starting a business. Sometimes businesses don't do very well. Sometimes a successful business will become unsuccessful. It's just part of it. Like, you need to just accept that fact, right? Businesses can fail. Businesses can succeed. A successful business can fail. And a business that's not doing very well can end up succeeding, okay? You just don't know. You don't know until you get in it and you start doing it, right? So her clinic, I think that's best to, instead of just scrapping it all, to just pivot, add some more services to it. She's dual certified. There's no reason why she can't. Do something that's complementary, or maybe just do something that's just as a DBA, underneath the same LLC. Maybe just do a little bit of men's health or something, okay? But she has the backup of getting credentialed with insurance. And if she did that, then chances are she probably would be very successful, but she'd have to deal with the insurance headaches. And she doesn't want to do that, and I respect that. She wants to do cash only. I don't blame her. I don't think I would ever go back to insurance ever again. So lots of decisions for Autumn, and I wish her the best of luck. All right, hope you guys enjoy this episode. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcast. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.